You know, the President, Cyril Ramaphosa, signed the NHI Act into law, which means that in the next few months we will start to see what's supposed to be the implementation of the funding part of the NHI. But at least 6 organisations have said they will challenge the Act in court. They will try to stop it from being implemented. There have been various claims that the NHI will have a huge impact on private healthcare. People who support the NHI say it will provide more equitable access to healthcare. Volker van Widdern is the head of strategic risk practice at Riskonet Africa. Volker, good afternoon to you. As you know, there's a lot of emotion about this issue, and in some cases, actually, quite a large amount of fear. When you try and look at this objectively, what kind of risk issues do you see? What kind of challenges could it pose?
Well, I think we've got to split them between what the general public correctly perceives as a significant change to the way healthcare is provided to them. That is the public that's in the private sector and on medical aids. And I think the point that we'd like to also bring into focus is that there are strategic risk factors that affect the major providers of medical services, the hospital groups and allied services. And then not to forget that the employers have a significant stake in this as well. So if you generally describe your people as your greatest asset in the business, then if those people are insecure in terms of their medical care, if there are different kind of access provisions, longer queues, perhaps quality of healthcare changes, those kinds of issues are quite important for employers in terms of productivity. And of course, the healthcare groups are employers themselves. And there's a huge amount of uncertainty about what happens with healthcare practitioners, which means that they have a significant issue there as well. So I think there are a couple of dynamics in play here from a strategic risk point of view for normal corporate employers, the state as well as the medical service providers.
Is there something that people really need to worry about now? We're still years away from it really being implemented. And in fact, I hate to say this, but we're probably years away from knowing exactly what the NHI will be.
Absolutely. Nothing's going to change in the next couple of months or year or so. And that is the case. The difficulty is that medicine infrastructure, healthcare infrastructure is not set up, like a low-cost, low-budget affair. These things require 10, 20-year financial models. There are significant investments. Hospitals cost a couple of billion each to build. And what we need as a country is ongoing growth in our health infrastructure. Now, the whole point about delayed NHI is a double whammy. If one doesn't know that what the revenue allocation model is going to be and how it practically works out over the next 5 or 10 years, how would then whoever's interested in healthcare services be confident about rolling out major capital assets? So what we actually need as a country is more and more investment in healthcare with reasonably predictable revenue streams. And the fact that the NHI is going to be quite gradual means that there's a high level of uncertainty over a long period of time, which means that the likely investment in health infrastructure is going to be delayed and further exacerbate the problem.
Okay, so in other words, the risk of a shock to the sector grows probably exponentially just because of the NHI Act. Just because it was signed into law, there's likely to be a decline in investment.
Yes, or a pause. I mean, the environment is more difficult. There's certainly no clarity on future returns. And if the price points are managed in a way that makes the returns, let's say, challenging, there's no ways that happens. Then you have a situation of the second part of freedom of choice, both for the doctors, the professionals, where they provide their services, and that is if they are reimbursed by the NHI. And that's a huge assumption in the first place. Doctors are fully capable and able to receive payment from any member of the public. At the moment, most of that money comes from medical aids. But the issue is that if they aren't going to receive the chosen reimbursement from an NHI for the deployed, let's call it, service, then they have a very small share of revenue to look forward to. Under those circumstances, preservation kicks in. They go and look for work where they have a more stable income. So the services, the private sector then has a reduction of resource base, prices go up and capacity goes down, which is another double whammy.
The other issue is we still don't quite know how it will be funded. Now, we kind of know where it's going to have to be funded from. We know it will be expensive. The sort of amount of money has been projected at around 200 billion rand. I think the Health Department says that it will be less than that. But the money can only really come from tax, income tax, VAT, corporate tax. Do you see it happening in that way? I mean, just an increased rate of tax to pay for it. I realise you're not an economist. There's probably a risk to the economy in that. But is there a risk just because we don't at this stage know how it will be funded, but we do know it will have to come from tax?
You're right. I mean, there is little else. So at the present, even if the tax rebate for medical aids is withdrawn, that's 37 billion. People will happily carry on paying their medical aid. You know, that's actually my assurance. The point is that if people aren't allowed to get their free choice out of the medical aid subscription, they are very highly likely to withdraw from the medical aids and start saving that money in their own right. So there's no assumption, really, the credible assumption, that the medical aids that get roughly 200 billion will simply pass this through the NHI to a third party over which they have no control. So it's possible that maybe, 25, 30% of this does get through the process. But then the health budget goes from 250 billion to 350 billion, and it must absorb most of the private sector, in which case the costs go through the roof again. So there's a further challenge of limited resources over an even bigger pool of potential entrants to the system. So it is this very significant funding challenge. Volker, and the point there is that delivering private sector healthcare to the population, which unfortunately isn't in a position to afford it, that's the challenge of the funding.
Volker, is there another risk? This may be a risk just to government, but I think there may be perhaps an associated risk to the rest of the country. If government makes a big promise, it is going to change things, it is going to implement what is a very difficult thing to do in any country in the world. Let's just be clear, health coverage is political, okay? Now, government's made all of these promises. It's got to do quite an intricate thing that involves finances, that involves the private sector, that involves government. The health minister has quite a lot of power in this. And if government then fails to do it, is that a risk all on its own? What I'm trying to get to is it possible to quantify the risk of a government making a big promise and not implementing the promise?
Well, I mean, the challenge then is that, the government's credibility will suffer enormously. Let's say the knock-on effect can be incredibly unfair on the population, because it may well be that you remove a couple of politicians from parliament, but rebuilding the health system may take another 10 or 20 years if it has collapsed through the mechanistic transfer of medical aid funding, which is going to result in an entirely different funding model and people taking on enormous personal risk to finance their healthcare privately. So there are knock-on effects in the credit markets, the bank markets, the healthcare sector itself, and then rebuilding our health system in 5 or 10 years' time at double the price with inflation is a secondary effect. So there are significant knock-on risks in that environment.
Volker van Widdern, thank you, head of the strategic risk practice at Riskonet South Africa, Riskonet Africa rather.